Bismillahirrahmanirrahim. Today we are discussing the vitamin D, the sources of vitamin D, the functions of vitamin D, the deficiency symptoms of vitamin D, the needs of vitamin D, and the factors which can affect vitamin D. So let's start from its source. Foods are the low sources of this vitamin. That is, the meat, milk, fish, etc. are its low sources. It is mainly present in the human beings and animals in the form of sterols and cholesterol just beneath the skin, just below the skin, and in plants it is present in the form of ergosterols just below their peels. It is converted to the vitamin D by the sunlight or the ultraviolet light to the vitamin D. And the vitamin D then plays a vital role in the absorption of the calcium and phosphorus for the growth and maintenance of the mammals from the intestinal tract. So if we say that the absorption of calcium and phosphorus is due to the vitamin D, which is synthesized from the sterols and cholesterol in the animal and ergosterols in the plants, it would be much more appropriate. It is required for the bone, teeth formation, etc., and for the growth. If it is not taken in sufficient amount, that is, if the human beings are not exposed to the sunlight or where the sunlight is not in abundance, or the bodies are covered largely by the clothings and other wearings in the winter, its deficiency can occur over there. If it is deficient in the bodies, the softening of bones can take place, which is called the rickets and osteomalacia, which is the most severe form of its deficiency. In rickets and osteomalacia, the bones are weaker and the bones become soft. The growth is affected, and the growth is, in simple words, we say that the growth is retarded. It is resistant to the heat and are more stable to the heat and are not affected by heat treatment or cooking. So its losses are the least in this case as compared to the vitamin A. Its needs are greater in the children because of their growth, and in the male it is required by the male in greater amount than the female. But if the female are in the position or in the form of the lactating mothers or the nursing mothers, then the need for the vitamin D will increase in that case. So the mothers needs more vitamin D than male, and the female in general who are not the nursing mothers require this vitamin in lesser amount due to the lesser body size. In this lecture we discussed the sources, and the concept was also cleared that it is not present in the sunlight but it is converted, that is, the sterols and cholesterol in human beings and animals are converted into vitamin D, and ergosterols in plants are converted into vitamin D by the sunlight. And this vitamin D then helps the absorption of the calcium and phosphorus from the intestinal tract for the growth and maintenance of the mammals. Its deficiency can cause rickets and osteomalacia. It is not affected by the heat treatment. and the needs are greater in children, then in the lactating mothers, followed by the male, lastly by the female who are not the nursing mothers or who are not feeding their children. This was all about the vitamin D. If you have any question about this vitamin D, you can ask us. Thank you.